So your planned Caesarean section journey will start here in the main atrium of Worcester Royal Hospital. Most mums and dads will have visited the maternity department at some point during their pregnancy, but the place you need to get to is the postnatal ward. From the main entrance, you'll need to make your way down the left-hand corridor from the atrium all the way to the end. At the postnatal ward, bleep the buzzer and your midwife will come and collect you and take you onto the ward. At this stage, your midwife will show you to your bed. She'll explain how the day will work. The first hour or so after you arrive will be busy. Your midwife will check all the appropriate documents and tests are in order and help you get changed into a gown for theatre and the tight stockings that most women need to wear to prevent blood clots after the procedure. At some point, your obstetrician will come and talk to you about the procedure itself, what you can expect from and after the surgery, and get you to sign a consent form. That reassures us that you are aware of both the benefits and the risks of the operation and that you're happy for us to go ahead. Your anaesthetist will also come and talk to you about what type of anaesthetic will be the most appropriate for you on the day, but the vast majority of women, a spinal anaesthetic is the safest and the most effective technique. At this point, we can go over the process for the day and answer any questions you might have. With 2 theatre areas now available for use at Worcestershire Royal, we're able to treat emergency cases without interrupting the flow of our planned elective deliveries. This means we can keep delays to the running of the list to a minimum, and if we do have any issues which might cause a delay, we'll do our best to keep you informed as regularly as possible. Patients undergoing planned surgery are asked to have nothing to eat for at least 6 hours before the time of the operation. But what we will do is actively encourage you to drink up until about 2 hours before the procedure. The sort of things you can drink and we'll encourage you to drink are water, fruit squashes, not fresh juices, tea and coffee with a small amount of skimmed or semi-skimmed milk. If you've got any questions or concerns about what you can or can't eat and drink, ask your anaesthetist, especially if you're not first on the list and may have to wait a few hours. The key thing is to avoid fizzy carbonated drinks.